Hello, everyone, and welcome to this live conversation on this, the last day of Caribbean Wellness Week. My name is Lisa Bailey, and we're so glad that you could join us today on our PAHO Caribbean page and our Twitter PAHO WHO regional account. So today, as I told you, is the last day of Caribbean Wellness Week, a week where generally, back in the day, we would have been outdoors having lots of different events where we focused on different aspects of wellness, but things have been a little bit different of late. However, we still are going to focus on the different aspects of wellness, but this year we're talking again about building equitable communities. Now that's the theme of the PAHO WHO Wellness Week, but this is one area where we collaborate very closely with the Caribbean Public Health Agency, and we actually work together. So we have very close themes, and it's in it together, building healthy communities. So we're all talking about equity, working together, and power through collective action. So we're joined today by two guests. I can't believe it's been a year since I was able to speak with these two lovely ladies, but we're back together again. I want you to please join with me in welcoming Dr. Joyce St. John, Executive Director of the Caribbean Public Health Agency. And we also have Zeri Eichmann. She is Unit Chief, Health Promotion and Social Determinants of Health with the Pan American Health Organization. Welcome to the conversation, ladies. And let's start first by asking, how are you doing? Jerry?
Marvelous.
Good. What about you, Jerry?
I'm fine. Thank you. It's Friday.
It is. And the last day of Caribbean Wellness Week, quite a lot goes into the preparations for this week. We share all of our materials and we share the stories that are coming through from the different countries, not only in the Caribbean, but across the region as well. And today, again, we're talking about equity. What does it mean, Jerry? Let's start with you, for a community to be equitable and healthy.
Thank you. Thank you very much, Lisa. And what a pleasure to be here with my dear friend, Joy. I can call her Joy. I don't have to call her Dr. St. John. And Lisa, thanks very much for being here with us and everybody who's online. So equitable and healthy communities. It's really about have everybody, independently of their skin color, of their socioeconomic class, of where they live, where they work, having the same opportunity to a healthy life. So what we're seeing in our region is that this is the most inequitable region, and we define inequity as situations that are unequal and unfair. So this is the most inequitable region in the world. And of course, our communities are suffering from that, because it really depends here where you're born and how old you're going to be, where you're born, and how are you exposed to COVID, when you're born, where you're born, and if you're going to have chronic diseases or not. So that is really, what we're looking for is to reduce those gaps and really make sure that everybody has an equal chance to health.
Dr. St. John, let's talk a bit more about this region and why we say, as we said just now, that this is one of the most inequitable regions in the world.
You know, as I listened to Jerry, I felt sad, because so much has been achieved in this region, and so much is possible in this region, and yet these inequities occur. And this is one of the reasons why CARFA was determined, as we watched what was happening in the pandemic, who could get what commodity, if you could get PPE, if you could get ventilators. CARFA was determined that we would not be defined by what we were seeing, nor would we allow our member states to receive anything through us that could be tainted with this word inequity. And I did a lot of interactions with many groups around the world, and one was the Black diaspora. And as I listened to them, and they described how they were not able to access care when vaccines were available, at first they were not getting access. And I described what was happening in the Caribbean, and they were annoyed with me that I was not speaking from the position of a victim who was complaining about what was being done to them. And I flipped the discussion. And one of the things that we've done is to give our member states choice and to also give our member states access based on a variety of things. But the background is the burden of chronic disease. So in this region, although there has been much, in the region of the Americas, let me bring it broad first, there has been much to be ashamed about. There's still been a lot of ground that has been covered.
Definitely. And I think this Wellness Week was determined to show that there was solidarity, that we did see stories of hope coming from the community. Jerry, would you like to talk a bit about why that emphasis was chosen? And then maybe Dr. St. John, you can talk about some more of those experiences of hope and solidarity that we saw in these trying times.
Oh, absolutely. What we saw is that the communities really came together to support each other in those very difficult times. And very often it was because they had the need to do that. We could see, and if you look at South America, for example, they have a concept of soup kitchens, of collective kitchens, that is very old. That's not a new concept, but they really came back to life in this period of the pandemic. We have seen, for example, in Panama, where fishermen who caught their fish were sharing it with the community or the people who needed the food. So we've seen a lot of solidarity happening in our communities. There's many examples. What we shouldn't forget there is that even though this is something very positive, and we need to really make sure that things like that this continues and that we don't lose that. What's very important also is to see that it's very often happened in a moment of desperation, where people really needed that, and where governments were not necessarily stepping up on time to give the people what they needed when they couldn't go out to work, etc. So there's always two sides to this, but what is really very heartening to see is that, yes, there's been a lot of solidarity in the region, and this is very positive.
Dr. John, would you like to give any input into some of the stories or some of the experiences you've seen of solidarity, and perhaps even civil society, how they've also been playing a role in this?
Well, I'm going to start first with governments, and I'm going to start with the heads of government, who very early on started to show that they were going to work together. And not only were they going to work together, they were going to demand that it would be an all of society approach. And so we saw the mandates for harmonized protocols, for collaboration. And then I want to go to the all of society. And some of the stories that Jerry just told us were duplicated in Caribbean fashion across the different countries. We had drives for food. Communities were given food, especially communities that were really ravaged by the fact that as tourism stopped, a lot of income stopped for people. We saw something else too, which I thought was fabulous. There was a recognition of gender, and there was a distribution of lady boxes for women to be able to have products for their menstrual cycle given to them so that there would be no lack at a time like this. So I saw solidarity as well in the health sector. When persons got donations of vaccines in the early days, they shared. When people got shortages, they reached out to their brothers and sisters and they shared. And we had a mechanism through the Regional Security System Air Wing, and it still continues today. I do a schedule for the samples that are flown into CARFA. They were moving people and supplies and equipment up and down, mainly the Eastern Caribbean, Eastern and Southern Caribbean, making sure that when someone had a need, if they needed a technician, whatever, that it got there in time. And there was also solidarity in the way we managed this from the technical perspective. The chief medical officers shared their successes and shared their failures and warned each other when there was something in the offing that may happen to a neighbor. So I watched all of this from this lovely perspective of CARFA. And for me, I saw more of the solidarity than I saw people suffering in silence on their own.
That's very true. You know, I think has been difficult, but it has shown us that we can work together. And not only, I mean, obviously through necessity, but we've seen that we're stronger when we work together. Let's drill down a little bit more. And I want to remind you that you too can be a part of the conversation. As much as we love to talk to one another, we want you to talk with us as well. So feel free to drop us a comment either on Facebook or Instagram, and they will be shared with us here, and we will ask these ladies your questions. But let's drill down a little bit more into how inequity actually impacts health and well-being. We've touched on a couple of them. Jerry, would you like to talk a bit about that? Because some of them are a little less direct.
Yes, thank you. I'm going to use the example of COVID, and I'm going to again use the example of some of our countries in the region. And when I say the region, I'm talking about the Americas. Now, of course, we're focusing here on the Caribbean, but we also, as a Pan American Health Organization, we work with all the countries in the Americas. So, and it's not always exactly the same what happens in the Caribbean and in other countries. So when COVID hit, very early on, the countries started to impose those measures of staying at home, washing your hands, the quarantines, closing borders, and tourism had to stop. So all those measures were there, but they were not impacting all people in the same way. There are people who are actually even better off now, economically, socially, than before the pandemic. But there are also many people who are worse off. They have lost their jobs, they have lost their income, they've lost family members. So, and this big difference has been very important. Now, so what has happened for particularly people who had difficulties of staying at home in some countries because they work in the informal economy, in the region as a whole of the Americas, about 50% of the people works in the informal economy, and they do not have social protection, social security. They don't have an income if they don't go out to work. So when that happens, they went out to work, and of course that made it very, very difficult to control the pandemic. Because people were still going out, they could not follow the measures because of their conditions. The same we saw with hand washing. So the people who do not have water at home or have to go to the corner to the standpipes, or they have much more difficulty in washing their hands. So what we've seen now, that those inequities are not only unfair and unethical, but they also were a problem in controlling the pandemic. So it has very deep effects and this is of course the example of COVID, but this will also be the same situation if we talk about chronic diseases, if about diabetes, when we talk about eating healthy. Now, if we don't have enough resources to do that, or we don't have the time because we have to work 2 jobs and we have children to feed at home, then of course this really impacts on our possibility to live a healthy life. So that's why equity and inequity, this difference between the possibilities of people to lead a healthy life is so important.
Would you like to add anything, Dr. St. John?
I want to go on a little bit more from where Jerry started. This whole thing about when people have to survive, they can't ordinarily follow protocols. And I think because we have to be starting to shape the world that we are moving into, we're being forced into by this virus. I think we need to start looking at our social security gaps and our safety nets, because a lot of these people who cannot afford to start working are people that we rely on for our vegetables, the doubles I was talking about earlier. And so we have to understand that we cannot continue to ignore them and to think, oh, they are on the margins, they will get through, because it is an issue for maintaining health, possibly security in the world that is being shaped. So we need to start shaping our world. So there's an inclusion, there is a space for those that were formerly invisible, but we've learned are very critical to our survival. And I want that we should do this, especially in the Caribbean, with preservation of our culture. Our culture is marvelous. It's taken a great toll on us because we are aggressive congregators, and most of the protocols are about keeping people apart. We have to find a way to create a space where people can still feel a connection, even if they can't be physically together. And we also have to create a space that includes those people who have to do things that may not be easy to control. So that's what I'd like to add to the conversation, the fact that we need to start looking ahead and not just thinking about going back to where we were before COVID. There's a lot about what was happening before COVID that wasn't right. And COVID showed us, COVID opened up that blind spot. Let's do something to really respond to that part of our society that we cannot afford to ignore anymore.
Is there a role, do you both think, for policy in this? I mean, certainly the pandemic has shown us that for some people and for some countries, it became about me, I. We know in the Caribbean, you mentioned about, for the most part, culturally, if I have 2 breadfruits, I give you 1. You know, that's culturally how generally we would live. But is there a role for policy in creating equity, you think? Jerry,
There
I see
has
you
to
nodding.
be.
So I was gonna let you go first, but whoever, go ahead.
Go ahead, Joy.
There has to be a role for policy, because policy is what creates space for improvement or decline. So there has to be an understanding by the policymakers and those who influence the policymakers that these are some of the things that we cannot afford to tolerate anymore. And I think there is also, on the other side, a role for the power of the people and hearing the voice of the people. A lot of what is going on during COVID is because the power of the people has started to take different turns. We're seeing a lot of vaccine hesitancy because people who were marginalized have gone with the words that said, don't trust the vaccine, don't take anything from the government. And that in itself is a lesson that we need to learn quickly. And we need to make those who are hesitant feel that they have a stake in things and not just ridicule them, have a perspective. So I think, yes, policy and an understanding of who influences the policymakers and taking the voice of the power and the power of the people into account.
Yes, I couldn't agree more. I think that to create equity, you need good public policies. You cannot create equity because we want it. It's not going to happen on its own. And that means that we have to, of course, have good public health policies. No, we have to focus on primary health care. We have to make sure that everybody has access to care independently of their income and where they live, where they work, etc. But you also need policies around water and sanitation. You need policies around housing. You need policies around migration. You need policies around social protection, education. So, and that's when we start to talk about is health in all policies. Everything housing does has an impact on health. Everything our water and sanitation organizations, institutions do has an impact on our health if we do not make sure that everybody has that access. So, and bringing it back also to what Joy is just saying, the information that the governments have been providing, well, there have been gaps, and they have not always been so accurate, and they have not always been based on evidence. We've seen that all through the region, all through the world. And that is the other issue of the trust. Now, how much do people really trust the government, and do they really want to do what the government says? So it's so important to have that work, like Joy is saying, with the communities, you know, not just telling the communities what to do, but really work with our communities. So because they are the ones who understand what our needs are. They are also the ones who understand what the solutions are. So building public policy is not something we're doing in an ivory tower or in a capital, in a government office. It's really something that has to happen at local level with our communities. And that is the way we can really shape things and make things different for a better future we are going to talk about.
Now, I live in hope in talking about post-COVID and after COVID. Why is equity so important in rebuilding after COVID? Can we dare to look forward? You're laughing, Dr. St. John. You don't want to dare to look forward yet?
No, because I don't think we'll have a post-COVID. I don't think COVID is going anywhere. I think what will happen with the virus, if we're lucky, it will stop mutating. It will become one of the viruses that circulate, and we will need boosters every year, or if we're lucky, 2 years. So I'm not sure if I can answer a question about post-COVID, because that's my belief. But perhaps we can talk about the post-COVID confusion, because clearly there's a lot of COVID confusion. A lot of it because as a world, we haven't yet learned how to share and how to ensure that what is available is spread out to many people and not just to some. So post-COVID confusion, I think we're going to have some constructs that exact a little bit more equity. Let's go back to the word. A little more equity in the distribution of what is needed to live safely with COVID and return to economic activity safely in the presence of the COVID-19 virus and its variants. We're also going to have a redistribution of the resources that are required for the quality of life, basic quality of life, that some have in such excess that they waste it, and others never ever see it. So it means a lot of change in the power structures, not just in the Caribbean, but generally overall, because the Caribbean is not a power broker in money. It's a power broker in other ways. So we have to find that point of inflection where everybody gets the message and makes a change.
Yes, thank you, Joy. I think we have been talking a lot about the opportunity that we have now, that everybody has seen the huge inequalities. It's more visible than ever. It's no longer something that can be hidden or that can be denied. So that on its own is very important. I have heard people talk about inequities, CEOs who never ever mentioned that. So there is an awareness in the world and in the region that we should bank on. Also, the work that was done, as Joyce said earlier, by the governments, the heads of governments led the effort of recovery. So, or recovery and control and recovery. And that's where we're going still, as Joyce saying, we're not there yet. But so that means that all the sectors were involved. So that's another opportunity. And I think the biggest opportunity we have now is to really analyze at what was wrong with our society and before COVID hit us, and not wanting to go back and rush back to that old normal, but really take this opportunity and reflect and act upon those inequities that has made it so difficult to control the pandemic, that have really put so many people in very, very stressful situation. I'm thinking, for example, about migrants. And it's not only in the Caribbean, but all over Latin America, all over the world, we have migrants. These have been people have been very, very hard hit. They were already in a difficult situation, but they have become now in a situation much more vulnerability. I'm thinking of the homeless. I'm thinking of those who live in shanty towns. So this cannot be the new normal. We have to think and collectively and, really agree on what that more equitable, healthy normal is. And it cannot be business as usual. It will take redistribution and very, very bold decisions at all levels.
I'm thinking as you speak, perhaps a lot of people are not aware of those things. Some of us live in our own bubble, some of the things you mentioned just now, perhaps our role in our agencies is to show a bit more of this so that people understand your level of suffering is, I can't go to a party on the weekend. You know what I mean? So perhaps our role in these agencies is to tell stories that reveal some of those ugly things that we may not want to focus on. Dr. St. John, you mentioned the public and the power of the people. So how can we support community initiatives so that we hear their voices as part of the recovery, as they lend their voices to policies or to programs in the community?
Well, a lot of their voices are being expressed in writing, in social media. And so we need to understand that medium and glean some of the voices and some of the messages from that medium. And I've seen more so that leaders, especially political leaders in the Caribbean, are following certain social media. But we also have to allow a forum for their voice to be heard real time. And the forum we're using now, the virtual forum, is going to allow more people who have access to the internet to speak. But first, we need to find the interlocutors that bridge that divide between the establishment and the voices of the people who have not been normally listened to. And once we bridge that divide, we have to create a safe space for a conversation that is new. New for those who have felt marginalized, so that they do not speak the language of a victim, but they speak the language of an influencer. And I find that the young people have found that space. They are able to articulate what is wrong, but not in the voice of a victim, in the voice of the visionary of what the world should be. So I think using the voices of young people is going to be very important in shaping the world that we're going to be. That COVID-19, SARS-CoV-2 virus is forcing us into, because there's no way that anyone should be trying to get back to what was. The virus won't let us.
So true. Would you like to add anything, Jerry?
Yes, I think on that last point, I do think that there are countries where the virus has taught very little, because we are going back to that old normal, and we have not necessarily, learned the lesson that COVID has taught us. So I think we have to be really acutely aware of that opportunity that does not necessarily translate in a new reality. And for that, the voices of the people and working with the people, giving everyone a voice, because again, it is even, although COVID, with all the platforms and the use of social media and the use of electronics ways of communicating, of course, have given many more people a voice. But there's still a large group of people who don't even have that access. And we've also seen that we assume that everybody has a cell phone or a computer or access to internet. And of course, many people do, but not everybody. So we still don't have given everybody a voice. So, but I do totally agree with Joy that the youth, really the young people, are the ones who are going to be absolutely crucial and are crucial in this discussion. And that we really have to listen to them and work with them to work towards more equitable societies and communities.
Agreed. And a lot of them immediately go to a human rights approach. This is our right. I was just thinking as you spoke about a conversation I had with my daughter who's 10, and she was listening to the news about, the lack of vaccines in some areas. And she said, "But mommy, isn't that unfair?" And that started a conversation about, sometimes things aren't fair. And then there are, a whole set of questions, but why isn't there a rule on that? And this is what we're talking about, but children break it down in such a simple but beautiful way. And sometimes for us working in this area, we need to realize that it's really very simple. This is unfair. Your access to vaccines shouldn't be based on where you live. Sorry, that was just my little soapbox moment. So in terms of CARFA and PAHO for Wellness Week, what is the call? What is the call that we want people to hear as we wrap up this 2021 Wellness Week? Dr. St. John, you first.
In it together. That's it. And it's been a real pleasure for me to have worked this year with Jerry again. And although CARFA is representing a fraction, the CARICOM fraction of the region of the Americas that Jerry administers through PAHO WHO, Jerry let me do the Caribbean interpretation. And she did the regional interpretation with Wellness Week. And I really liked the way that there was that interplay. So the little bit of our culture comes through. And I think that that's the way that CARFA and PAHO are going to work on many things, not just this topic. I'm going to go to my big sister, Jerry. And I'm going to say to my big sister, Jerry, this is my problem. How can you help me? And together we're going to work it out. And then I'm going to do the Caribbean interpretation of the solution we've discussed. So in it together, to me, is the most important thing for how CARFA and PAHO are going to go forward in many areas, talking about wellness, NCDs, talking about wellness, COVID-19. And I am hoping that my big sister Jerry will keep walking with me in this way.
Well, dear Joy, by no means, I'm the big sister. You're really the one I look up to for your fantastic work and your vision. It's absolutely fantastic to be able to work with you on this. And as you say, it's so important to have the same vision. We're going in the same direction. We are pushing the same thing, but we do it from our corners. We do it from where we are, and we do it taking into account our cultures, our people, and that's what I really appreciate in this partnership. You know, talking about equitable communities is a big thing. It's a big thing. It's not easy, but it's extremely important. So in order to be able to make a dent there, to move forward to that vision, to that aspiration, we need to work hand in hand. And I'm very, very happy that we doing that with CARFA and PAHO, so that we can really, you know, go together on that path. And thank you so much for all your support and for fantastic collaboration.
And there are really two wonderful themes. I actually wish we'd done shirts or something, because in it together is so Caribbean, you know, we in it together, we're fighting this battle. I think we need to keep this theme for a couple of years, because we're going to be in it together for a little while longer, I'm sure. So it's a good thing that you like each other so much. So how can we continue to collaborate to promote equity in health? Not just in COVID, in health in general.
I think the power of PAHO, because remember, PAHO is also WHO's big sister, because before there was WHO, there was PAHO. I think that role of, it's not the elder statesman, but it's that role of, I've been here and I've been through a lot. It's a role that PAHO has to continue to play. It has to continue to tell the story. It has to continue to say, this is not what we will tolerate when it comes to issues of inequity. So I think that role, the persona that I gave to Jerry just now as my big sister, the persona of PAHO, should continue to be that of the big sister in the region of the Americas, which has the greatest inequity, and telling the tale, not accepting it, and talking about what needs to change, and showing our policymakers, not just in health, what are some of the tools they can use to make that difference. So that is how I would like to keep working with PAHO. And CARFA will do the interpretation from the Caribbean perspective. We will do it with Calypso, we will do it with reggae, we will do it with doubles, we will do it with Fish and Festival. We will do it with Cuckoo and Flying Fish, but we will also tell the tale.
So well said, Jerry.
Yeah, no, wonderful. Yes, and PAHO will continue to put the social determinants of health that determine, you know, our health through our living conditions, working conditions, etc., on the agenda, work with governments, with all governments, to really make sure that we keep focusing on equity when we design our policies, even our health policies. It's not only the other sector, also our health policies. Now we have talked about vaccine, etc. And for that, PAHO cannot do that alone. So we need strong partners. So we had actually also during this week, we had the head of Comisca, we had discussions with her for Central America on how we can work together. We had another Facebook Live where we talked with the public health associations from South America. So we really, and that's where we don't dance calypso, but maybe we dance salsa or merengue. So we really need to have all these cultures and forces together to really make that path forward towards this more healthier, more equitable society. It is, as Joy is saying, we're in it together and we really can push that. And our partnership is absolutely crucial in that sense.
Well, thank you very much, ladies. I think we had a lovely discussion.
Oh, it was even better than last year. I was thinking we can't talk last year. it was even better.
Well, I'm glad you enjoyed the conversation, and I hope those of
Yes,
you
very
watching,
much so.
I hope those of you watching on PAHO Caribbean and on our Twitter PAHO WHO page also enjoyed the conversation. If you're just joining us late, you can go back and watch it later. But basically, we were talking about Caribbean Wellness Week, the 2021 campaign, Building Equitable Communities. It followed the call to action from World Health Day to eliminate health inequities, to build a fairer, healthier world for everyone. And in the Caribbean, we translated that to in it together. So I'm glad you joined us today, and we hope that you learned something from the conversation. And I promise that I will be a part of the people who will help tell those stories, because we need to tell the stories of inequity so that we can make a difference. Yeah. So I look forward to next year, and I hope we can talk again on another Caribbean Wellness Week. So thank you so much for joining us, Dr. St. John and Dr. Eichmann, and to all of you who watched us on Facebook and Twitter. I'm Lisa Bailey. Have a wonderful rest of your day. Bye for now.
Thank you, everybody. Stay safe.
Thank
Stay
you.
safe.
Absolutely. Stay safe. Bye-bye.